My name is Malcolm Cunningham. I am the Health Outcomes Manager for ProMedica's eBide Neighborhood Promise. The eBide Neighborhood Promise is a place-based initiative in Toledo, Ohio that works to address the social determinants of health. Within my work, I essentially deploy dollars, work with partners, and develop and run a number of programs that address health and well-being. Our focuses include maternal and child health, chronic disease, food security, and violence. So one example of the work that we do is a project that we've been working on in partnership with Boston University's RISE Lab, the Lucas County Land Bank, the Mayor's Initiative to Reduce Gun Violence, and several other grassroots organizations. With this project, we pair satellite imagery with shootings, with census data and other indicators in order to understand which areas are most at risk in a really granular way. From there, simple efforts such as blight reduction, improving the quality of homes, greening, beautification can reduce the risk of violence and actual violence without it being displaced elsewhere. So while still relatively early in the Bloomberg Fellowship, the depth of knowledge, the perspectives of practitioners, of students, of professors from across the country has just been stunning and quite helpful. I'm looking forward to continuing to deepen my knowledge, my understanding of public health, and applying it in the context of Toledo.
Good morning. My name is Janelle Covage, and I'm a Bloomberg Fellow working in violence prevention. In my role at the Johns Hopkins Center for Gun Violence Solutions, I lead suicide prevention, impacted community engagement, and racial equity initiatives. I'm looking forward to the upcoming panel because evidence-based policy is part of a comprehensive approach to gun violence prevention. Please welcome Senior Advisor for Implementation at Everytown for Gun Safety, Ruhi Bengali, Co-Director at Johns Hopkins Center for Gun Violence Solutions, Josh Horwitz, and your moderator, Managing Director of the Trace, James Burnett.
Thank you, Janelle. Thank you, Josh and Ruhi, for the insights you're about to share. Look, any conversation about gun violence, it has to acknowledge the lives lost. But it's equally important to acknowledge the progress that is being made, because that's how we understand this issue, not as intractable, right, but as something we can solve together. Josh and Ruhi are going to share what's giving them hope, what they see as some of the unfinished business for the public health model for violence prevention. We're also going to take your questions at the end, so please get those ready. Let's dive in. Josh, one of the bright spots in violence prevention has been something called extreme risk protection orders. Bring us all up to speed on what those are, how they work, and importantly, what do we know about their effectiveness?
Thanks. Extreme risk protection orders are state laws that create a civil legal process that law enforcement and in some states, family members and increasingly medical providers can ask a court to remove a firearm from someone who's at risk to self or others. They're modeled on domestic violence protection orders, so similar to those, it's a civil process, except these are focused on firearms, the removal of the most lethal means. So far, the evidence has shown that when it comes to harm to self, we're starting to get a body of evidence where the arrows are pointing that this is actually an effective strategy. Now, let me say, these are all these laws are new, so we're really starting to collect the evidence. And then when harm to others, interpersonal violence, the research is really early. But there's definitely some qualitative research that shows that some of these cases have been used to remove firearms from people intent on mass shootings like school shootings. So I'm very hopeful for these. They're in the infancy, and we need to go beyond the 19 states and the District of Columbia that have them and implement them in many states, more states across the country.
Let's talk a little bit more about the implementation. Ruhi, in some jurisdictions, we're seeing that it's law enforcement and city attorneys who are the most avid users of ERPOs. What needs to happen to ensure that these policies are used as a public health tool and embraced by clinicians and community members?
As Josh mentioned, extreme risk protection orders, or ERPOs, are an effective gun violence prevention tool that have gotten a lot of positive attention the past few years. And we need to look further to see where they're being implemented and how. And the data that we've collected shows that there's wide variation across states as well as within states. So Maryland, Florida have the highest per capita rates of ERPO usage, whereas Hawaii, Nevada, New Mexico have really low rates. And what we're finding is that having champions on the ground and having a robust infrastructure for ERPO implementation really matters. In jurisdictions such as King County, Washington, San Diego, California, they had committed stakeholders on the ground who invested in processes and protocols and ensured effective implementation of this tool, which is now, we're seeing that in the numbers. And I say that because at the heart of it, however effective the tool may be, it's not going to implement itself. We need to be investing resources, and so if we want to increase usage across the board, but particularly amongst clinicians as well as the community members, first and foremost, we need to raise awareness. Most practitioners and people just are not aware of the very existence of the tool. Secondly, we need to invest in training resources and modules so that these stakeholders understand when is it appropriate to use an ERPO, what are the steps that they would need to take within a particular state in order to get one, and so on and so forth. And then lastly, because there are so many stakeholders involved at various stages of the ERPO process, there needs to be better communication and collaboration across all of those levels.
So we have ERPOs, we have the Bipartisan Safer Communities Act, we have too many new funding streams, or at least available funding pools for public health interventions, street outreach, the whole list, more than we can get into here. Think ahead for us 5-10 years. What's it going to take? The one thing you think is necessary to make sure that we don't squander this moment, the momentum that the field has?
I think, first of all, you have to take these resources and lean into them. We need champions in every state who are going to say, I will get those grants, I will learn about the Burn JAG program, and I will be the champion for this state. So it's understanding the federal streams of money, having, as Ruhi said, taking a champion who can lean into these things, and then all of us to say, we want to implement this. You mentioned hope at the beginning. I have lots of hope, but hope's not a strategy. Y'all need a strategy. We all need a strategy for implementation, and we're working hard on that.
Ruhi?
As Josh said, implementation is the name of the game. We already went over some of the steps of that. I think in addition to that, those who are most impacted by gun violence need to be part of the solutions. There are racial disparities across the impacts of gun violence, and those communities need to be in the room when we're making decisions on what the solutions need to be for those communities. I think that includes using this funding, these resources, to expand our focus, not just on the implementation of the policies, which is extremely critical, but also to focus on underlying factors of gun violence, such as focusing on investments in housing, employment, mental health resources, healthcare access, the list goes on. It is truly a public health approach to gun violence.
So let's now take some questions from the audience. I think we have time for one, maybe two, maybe three if we talk fast. Who's got a question for Josh or Ruhi? Raise your hand. We've got mic runners. I see one here in the front.
Are you including emergency departments in the education about this and maybe integrating this into order sets, for example, in emergency medical and in electronic medical systems?
So Shannon Frateroli, who couldn't be here today, but is leading that effort and trying to create healthcare navigators so that we're piloting some efforts within Baltimore to look at exactly those issues, how to make this easy for clinicians to do this. Yeah.
Thank you. There's a hand up in the back.
Hi, thank you for this important conversation. My question is about the, do we know about how the ERPOs are actually being used?
We know a little bit. We need a lot more data, but I think what we're finding is that there is research and data to show that, in some states, a vast majority of them are being used in cases where someone is threatening self-harm, is at a risk of harming themselves. But there are increasing number of cases across all of the 19 states that are showing that these are cases where folks are threatening a specific individual or are even threatening sort of mass shootings or school shootings, and those early signs are being picked up and intervened on, and an ERPO is being issued.
We have time for one more.
Good morning. Thank you for a very informative session. I was wondering if you could share your thoughts on what are the most critical issues ahead for ERPO in the US?
I think you need to have more education. We need to ensure there's access for every community, and we need to make sure that we fully evaluate these laws and the data is available.
Thank you, Josh. Thank you, Ruhi.
Thank you.
Thank you.